Tonight, Ontario makes a big move to open up vaccinations to more people. People aged 40 and older will soon be able to book the Oxford-AstraZeneca vaccine after growing demand to lower the minimum age. We'll get reaction from a pharmacist who's been calling for just that. Plus,
we are mobilizing federal healthcare workers from across government departments to deploy to the front lines in Ontario and specifically the GTA, where the situation is most critical.
Ottawa pledges to send urgent help to the front lines. And
I'm already a high-risk pregnancy, so that also is very nerve-wracking for me.
With COVID-19 affecting more pregnant women, a push to put them at the front of the vaccine line.
This is CBC Late Night News.
Good evening. I'm Marivel Tarouk. We begin with a major development tonight in the race to vaccinate more people in this province. Ontario has lowered the minimum age for the AstraZeneca vaccine, and starting this Tuesday, those 40 and older will be able to get it at pharmacies and primary care settings. A spokesperson for Ontario Health Minister Christine Elliott told CBC News the province made the call based on the current supply of the vaccine. Previously, AstraZeneca was only available to those 55 or older, following guidance from the National Advisory Council on Immunization. Earlier today, the federal government said Ontario was free to expand eligibility to any adult over the age of 18, something the Ontario Pharmacists Association has been calling for.
It's welcome news. I think it's important step in the right direction to expand the age categories. We know that there's certainly a need to get to essential workers and to those that can't stay at home and work. Somebody who declined the AstraZeneca vaccine recently ended up getting ill, ended up in an ICU bed, and tragically passed away. And while that is a sad, tremendously sad story, it underscores the importance that we need to sift through some of the noise. And you have to look at the benefits, and they clearly outweigh the risks.
And for more reaction to tonight's news, I'm joined by Kiro Masse. He is a pharmacist in Toronto who has been among those calling for this change. Kiro, it's nice to have you on. I just want to know what your reaction is and what this will mean for you now.
So it was a huge sigh of relief. I was overjoyed when I heard the news that the age restrictions being lowered. What it will mean for me is, as soon as possible, I will be taking appointments for people above the age of 40. For me personally, I'll be prioritizing frontline workers, and then hopefully we can see the trend of cases start to go down as a consequence sometime down the road.
Well, tell me, I'd like to know what you were hearing from people who wanted to get vaccinated before the lowering of the age minimum, but couldn't. You couldn't give them the vaccine. What were they saying?
So I had people begging left, right, and center. I had people telling me that they have kids and they're frontline and they're having to deal with so many clients every day, and they just, please, I won't tell anybody. Please vaccinate me. I don't want to die before I see my kids grow up. You know, you hear these things and it just breaks your heart, and you can't do anything about it.
And that must have put you in a really difficult position too, knowing that you have the doses on hand and people willing to get the vaccine.
Yeah, absolutely. It felt almost like you saw a boat sinking and you have a life raft and you can't take anyone on board.
I want to touch on the whole issue of hesitancy as well. How much of that do you think there will be, given this whole concern over blood clots related specifically to AstraZeneca? And what do you tell people expressing those concerns?
So the issue with hesitancy is the public needs to understand that this is their first time reading medical literature, okay? We read medical literature all the time. So if we see that a drug has a 4 in a million chance of causing a blood clot, in our books, that's a pretty good drug. To put things into perspective, if you could read, there's one study that showed that Advil increases the chances of blood clot, I believe, by like 2.8 fold. And people don't bat an eye. They use that all the time. I've mentioned this previously this morning when I spoke with CBC, that if we were to give AstraZeneca to every Ontarian today, and every blood clot resulted in death, which it doesn't, and we could mitigate it, you would have 58 deaths in total. Yesterday alone, we had 34 deaths from COVID. So it's just that people don't understand the magnitude of data, and they're not familiar with it. But the reality is this risk is extremely minimal and can be mitigated, and that's the good news. And you know, and this vaccine can now save your life. So get it as soon as possible.
And go to trusted sources like pharmacists like yourself.
Absolutely, or physicians. Okay, that's where you should be getting your information from. And we could counsel you and tell you about the warning sign if you're one of the 4 in a million that get this, and you will successfully treat it, like the 2 cases we had in Canada that were successfully treated. Worth noting, though, 2 cases out of 700 million doses administered, which 700,000 doses administered, which again is pretty good in everybody's books in the medical field.
And that's very valuable insight to get from you tonight, Kiro.
Absolutely.
Thank you so much.
Absolutely. Thank you for having me.
That's Kiro Masse, a pharmacist in Toronto. The federal government is also taking steps to bring much needed help to Ontario's front lines. The CBC's Ashley Burke has the details.
It was almost a year ago that Ontario was forced to lean on the federal government, and it's about to happen again. But this time, it's more than the military.
The premiers right across the country are obviously concerned about what's happening in Ontario, and the conversations have been along the lines of what can we do collectively to help.
The Minister of Intergovernmental Affairs and the Prime Minister both on the phones with premiers this weekend, finding ways for smaller provinces and territories to help Canada's biggest province struggling with surging cases.
We'd love to be able to provide some personnel in that respect, some medical expertise.
Premier Andrew Furey, a doctor, has traveled with healthcare teams to Haiti and other countries in need. Now his province is sending help to Ontario too, including his wife, also a doctor.
It allows for some relief for the people who are working, 24 hours a day, 7 days a week, nonstop.
The federal government is offering to coordinate, transport, and cover the costs.
Transporting medical health professionals around the country.
We're putting everything on the table to keep you safe.
Also on the table, sending federal healthcare workers, boosting rapid testing in hotspots, and military medical teams. All of this after the political rhetoric escalated Friday, when Premier Doug Ford started pointing fingers at the federal government.
Would we be in this position if we were getting 300,000 vaccines back in February, like the rest of the world? The answer is absolutely not.
Vaccine shipments surpassed initial delivery schedules by over 50% for the first part of the year.
Earlier today, Doug Ford's office said that the Premier was getting in touch with European consulates to try and secure additional doses of the vaccine for Ontario. But after the federal government's press conference today, Christine Elliott, the Ontario Health Minister's office, got in touch with a different message, saying that they are grateful for the federal government's support. Ashley Burke, CBC News, Ottawa.
Another concern in this third wave of COVID-19 is its impact on pregnant people. Not only are there more infections, but pregnant women who've contracted the virus are also becoming sicker. Now, there are calls for pregnancy to be considered a higher priority for vaccination. Lorenda Redekop has the details.
Sarah Dunn and her husband are excited and nervous to be expecting their first child. She's 15 weeks along.
It's all new, and then to do this in a pandemic is obviously a little bit crazy.
But she's also worried. She has health issues, so it's already considered a high-risk pregnancy, and she lives in a COVID hotspot.
It's very nerve-wracking, and the fact that I have no idea when I'll be able to get a vaccination is just really scary.
More pregnant people are becoming sick with COVID this third wave.
This week, we've had 11 admissions to hospital, with the majority of those patients ending up in the intensive care unit.
Of the 20 beds in Mount Sinai's ICU right now, 6 are filled with pregnant women. And it's not just those with underlying risk factors.
Now we're seeing young, healthy women who do not have any other pre-existing medical concerns. And so now it's not just a disease of those who are at risk, it's a disease of anybody.
She says they don't want to see a single pregnant person on a ventilator. And given the higher numbers, there's a push to get them vaccinated faster.
But at the end of the day, we're seeing something very scary right now with pregnant people in the ICU.
Dr. Tally Bogler is co-founder of a popular Instagram account about pandemic pregnancies. She's one of the people advocating for pregnancy to be considered a higher priority for vaccinations. Ontario lists it as a risk factor. That's below health conditions labeled high and highest risk.
It is evoking so much anger, anxiety, frustration, sadness. And we're getting bombarded basically with messages on our Instagram account, probably on an hourly basis right now.
Sarah Dunn is still waiting and hoping to hear when she can get a shot. She registered with a hospital, not because she's pregnant, but due to her high-risk neighborhood. She wants anyone who's pregnant to be a higher priority. Lorenda Rudacomp, CBC News, Toronto.
A field hospital set up on the parking lot of Toronto's Sunnybrook Hospital is preparing to take patients starting tomorrow. This is meant to help augment hospital bed capacity and make room for more seriously ill patients. This is one of 2 field hospitals in the province designed to address capacity challenges. Yesterday, Canada's Public Safety Minister Bill Blair approved a request by the province to extend their use until the end of June. And a live look at Ottawa tonight, where starting at midnight, police will begin stopping Ontario-bound passenger vehicles as part of the provincial emergency order announced on Friday. Officers will be stationed at all 5 interprovincial bridges and the docks for 2 ferries. There will be exceptions for essential work, the transportation of goods, medical supplies, and the exercise of treaty rights. If you are among those who have to cross the border, this is what you can expect, according to police.
When you show up at the border, there's going to be some road calming measures, asking for people to slow down. You will require, obviously, a driver's license if you're driving a vehicle, and all the documentation as required under the Highway Traffic Act. We're going to ask for a reason for why you're going into Ontario, and then you'll be sent on your way. We're trying to plan this in a way that it's going to be a very short conversation, and people will be allowed on your way.
Here's Sophia with our check of the weather, and I'm kind of bracing myself for what you have to tell us, Sophia.
Yeah, I wish I had better news for you today, Marivel, and hello, everybody. April's a really fickle month weather-wise, but this midweek winter snowstorm that we are going to be talking about really takes the cake. My advice, go out and enjoy Monday. It will be by far the best day of the work week, because just look at Wednesday. We're talking about February-like temperatures for everybody across the board, and the potential of significant heavy shoveling snow for some of you. Cold Arctic air, soupy Gulf moisture, big active storm track right above us. And it's at a time as well when the buds are nearing bloom on some of the trees, so it's kind of sad. The heaviest swath of snow could see about 5 to 10 centimeters for some of you. It's kind of too hard to pinpoint the exact locations, and models are really variable right now. A couple different scenarios this early out is that heaviest swath of 5 to 10 centimeters could be maybe along the 401 corridor, or another model has it coming a little farther south, so maybe in the Niagara region. But yesterday we were talking about that heavy swath of snow, maybe being up in cottage country, so things could fall somewhere along the middle. We'll keep watching this for you, but it's pretty rare to have this kind of snow and cold this late in April.
Okay, we'll check in for the long range in a few minutes. Thanks, Sophia.
Welcome.
A special memorial in Nova Scotia to remember the lives lost 1 year ago after a gunman posing as a police officer killed 22 people. Stay with us. Welcome back. We have more now on one of our top stories. As we told you earlier, Ottawa is promising that help is now on the way in the battle against COVID-19. It certainly comes with a sense of measured relief for those who've been fighting to save lives. But as Greg Ross reports, there are still concerns over how fast and how effective that help will be.
Each patient requires one-on-one nursing to take care of them.
Jamie Spiegelman works in the ICU at Toronto's Humber River Hospital. He says there was a shortage of nurses in the province before the pandemic, but they've never seen anything like they're seeing now.
We need an ICU nurse. These are very specialized, skilled nurses that take care of people on life support machines, and not every nurse is equal.
With more and more patients being admitted into the ICU, Spiegelman welcomes the help from the federal government. But he has concerns about the ability to get qualified nurses to Ontario quickly enough and to get them up to speed once they're here.
We're province-based licensed. So that's true for doctors and nurses. So how is the government going to expedite a license of this nurse that wants to come from another province to Ontario? You have to learn the whole hospital system as well. For example, every hospital has its own computer system that you have to learn as a nurse to document what you're doing.
Toronto Mayor John Tory thanked the Prime Minister for sending help, telling the CBC in a statement, "We are presently obtaining details of the help offered so we can see how it can assist our efforts in the City of Toronto."
The help that the federal government is sending is needed in terms of the place that we are right now.
Michelle Dagnino is the Executive Director of the Jane Finch Community Centre, one of the hardest hit areas in the province. She wonders if too much focus is going to treating COVID-19 and not enough to preventing it.
This is not a crisis that is solely taking place in our hospitals.
She says many residents in the area are getting sick on the job.
They are the essential workers that keep our groceries continuing to come to our door. They are the essential workers who are looking after our children as childcare workers.
But if they fall ill, they don't get paid sick days, something she says Doug Ford's government has ignored.
The provincial government needs to enact paid sick days.
The province is banking on new, stricter lockdown measures, along with the help announced by the federal government today to help slow the spread of COVID-19.
Is it going to be enough? Really depends on the number of patients that come through the door in the next 2 weeks.
Greg Ross, CBC News, Toronto.
Investigators would be looking to speak with anybody that does have information. Again, it's putting the puzzle pieces together in order to find out exactly what has happened.
Peel Police received a call this morning about an incident in the area of Goreway and Morning Star Drive. When they arrived at the Mississauga home, they found a man with gunshot wounds. He was pronounced dead at the scene. The name and age of the victim has not been released, and there have been no suspects identified so far. Peel's Homicide Bureau has taken over the investigation. Nova Scotia today marked 1 year since a gunman posing as a police officer left 22 people dead.
Last April, our hearts were shattered. The unthinkable happened here.
That was Nova Scotia's Premier speaking at a special memorial service in Truro. A marathon also took place in Portapique, where the rampage began. Runners will put the money raised towards a permanent memorial for the victims. Gabriel Wortman, dressed in a police uniform, killed his 22 victims over 13 hours. He torched homes and killed neighbors, acquaintances, and strangers. His journey ended in Enfield, where he encountered police and was fatally shot. A public inquiry is ongoing. Its final report is expected in November of 2022. And that's a live look at Niagara Falls tonight. Sophia will be back with your weather forecast for the rest of the week. Stay with us. The charity Islamic Relief Canada delivered thousands of warm meals across the country today to mark the holy month of Ramadan.
You know, it's in the spirit of Ramadan. It's the Muslim month of giving and fasting, and it's part of our religion to give back. From the onset of COVID, we've seen a spike of, more homelessness in Durham. We've seen, people lose their jobs. So this is just us giving back to those that really, are part of our community and are suffering at this time.
Islamic Relief Canada has partnered with more than 25 restaurants in 21 cities across Canada, preparing more than 3,000 meals for low-income Canadians. In Durham, the group is teaming up with Northern Smokes and Nourish Food Bank, which services close to 100 families. While it's the charity's second time doing the Islamic Day of Action, volunteers focus year-round on providing emergency supplies for those experiencing homelessness. So you've got a forecast that's really one for like March or February, isn't it?
Yeah, it totally takes the cake. And exactly, this is something that we would talk about, a picture-perfect setup, Maribel, for December, January, February, even March, even early April. Not this late in the season, though. A late April winter storm, it just rolls right off the tongue, doesn't it? It will be very track dependent, though, so it's still really early. I'll take you through some of the scenarios now, but we are talking about accumulating wet snow for somebody midweek and plunging February-esque temperatures. I really wish I had better news for you. There's two factors that are contributing to all of this: Arctic air and a plunging cold front. Now here's the thing, to set this in context for you. Last April at Toronto Pearson, we had 0.4 centimeters of snow only recorded on April the 9th. So that was early in the month. To get this much snow this late in the season is fairly rare. And again, we're talking about maybe the potential of snow in Niagara region, which, a lot of orchards, a lot of vineyards, a lot of blossoms in bloom right now. Here's how it all plays out for you. Monday, great day, go out and enjoy it. It's Monday evening into Tuesday, scattered showers roll in for everybody. Seasonal, great, we're okay with that. And then the Arctic air pools in afterwards. It's in the prairies right now, and they're experiencing a temperature drop of about 20 degrees. So we're gonna get that Tuesday into Wednesday at the same time that this low pressure system comes on over top of us. This is going to be a Tuesday night into an all-day Wednesday type of story. It's a slow-moving system, but where will that heaviest swath of snow be? It's still too early to pinpoint it. Let's give you the scenarios as we know them right now, though. Option A is that heaviest swath of shoveling snow, that 5 to 10 centimeters possibly, will be around that 401 corridor, maybe north of the GTA, maybe Sarnia, Windsor, maybe even a little bit into Ottawa as well. But then another model is taking this system a little farther to the south. So this is more going to be a Buffalo, Western New York story, Niagara region. So we'll miss the brunt of it. But yesterday we were talking, as I mentioned early in the show, about this track being north in cottage country. Could go somewhere in the middle as well, and then you're talking a GTA snowstorm midweek. So we'll keep watching this for you. Highly variable at this point, but I'm a little worried about my flowers, Maribel, depending on where we are in the GTA.
The flowers, the lawn that I was starting to show little shoots of green, and
we just overseeded and fertilized, and as did many around the GTA. So it's going to be short-lived, but it will be cold enough in the wake of this system to have snow coating the ground for a little while, and maybe coating some of the buds on the trees as well. It'll be one to certainly watch, especially for a lot of the farmers.
Yeah, there's a lot to watch for, and as you say, tough to pinpoint right now, Sophia, but we're all just going to brace for the snow to hit on some
You and
measure.
me both. We'll keep you posted.
Okay, thanks for that. And thank you for watching. That's our show for you tonight. Have yourselves a great night, but take heed for the weather that's headed our way this week. If you go outside, only do it if it's essential. But remember, no matter what it is that you do out there, take care of yourselves